Morning, everybody. I hope you're having a great day. It's another episode of Talk Live. Yeah, that's right. So welcome to the show, everybody. Another Tuesday, another Cloud Talk Live. Interesting show. We're heading down a vertical road today. We're going to talk about all things healthcare. But you know the routine here, friends. If you are new to the show, we'd love for you to introduce yourself. Tell me who you are. Tell me where you are. If you're in Texas, are you getting cold weather too? I'm outside of San Antonio right now, and about 30 degrees, 29 degrees, and sleet. That kind of sleet, freezing rain, nasty stuff. We don't live in Texas to get these things. But hey, if you want to get a hold of us over here, this Cloud Talk Live program is part of what we call the Thought Leadership Program at Rackspace, known as Solve. You can see it in the email address below if you want to get a hold of us. Well, all you have to do is send a little email. It's going to come to everybody. I'm going to get it. Producer Daniel's going to get it. Megan's going to get it. Who knows who else is going to get it? Maybe Amar, our CEO, is going to get it. If you say something nice, I'll send it to him. Anyway, thank you for being here today. We kicked back off this 2023 season a couple of weeks ago. We had Seth on. He was talking about, what you're going to do with your career in 2023. Then last week, we dug back into the tech, having a conversation with the one and only David Linthicum. I hope you were able to be here for that conversation. It was fantastic. And also, we got into the weeds of what we can expect also in 2023. Now, that as a general and a broad conversation went super well. And again, if you haven't seen it, it's available. You can just go into our LinkedIn or over on YouTube. You'll find a copy of it over there. Well, today we're going to continue the digital transformation conversation, but we're heading down the road into the specific industry of healthcare, because I can think of no industry more that is being impacted right now by the transformation that's happening than that through inside of healthcare. And I've got Vinesh Kolpe. He's here. He is a healthcare executive. He works with me inside of the office of the CTO. He has worked for, we'll call it decades inside of the healthcare industry, specifically helping instantiate and bring about change through technology. And then, of course, we've got Sarah Richardson. Now, she is the SVP and Chief Digital and Information Officer at her company. And you're going to get to know each of them super well here today. So, Daniel, why don't we go ahead and bring them on up onto stage? All right. So, Sarah and Vinesh, welcome to Cloud Talk Live.
Good morning, Jeff. Good morning, Vinesh.
Yeah. Good morning, folks. Thank you for having us, Jeff.
Absolutely. So glad that you're here. And Sarah, you got up super early. You are a West Coaster, and we sure do appreciate that.
Yes, absolutely. You're welcome. Vinesh and I have been friends for a long time. So when Vinesh calls, you literally set your alarm.
That's fantastic. So Sarah, tell us a little bit about you, who you work for, a little bit about yourself.
Yeah, absolutely. I am the Chief Digital Information Officer for Tivity Health. We very specifically are probably best known for Silver Sneakers, which is our senior wellness plan, primarily through Medicare Advantage and Medicare Supplement. And we also have Prime Fitness and we have Whole Health Living. So it was a beautiful trifecta of solutions in healthcare. And then just this morning, we announced our acquisition of a company called Burnalong. Burnalong gives us another set of digital platform capabilities and acceleration for programming, for condition-specific programs, really to continue to create that footprint in that space and those experiences for our members. And I just love the synergies that we're finding out there, that today more than ever, the ability to, whether you're collaborating from an incubation perspective with different partners, or you're doing acquisition strategies very, very specific to expanding footprints and capabilities within your organization, it's the best time ever to be in healthcare. And very specifically for me, to be in healthcare that's adjacent to large healthcare systems, where I spent probably the first 20 plus years of my healthcare career. So to be able to continue to take everything you've learned in your career, watch what's transforming organizationally, and bring them together in new and different ways, that's fascinating. And it's work that never is repetitive and never really gets boring, even when we've been working towards the same end results for years. We just keep changing to, your point, the tool sets, et cetera. So I love what I do. I love where I'm doing it. And it's a wonderful time to be in this industry.
Fantastic. Thank you so much for being there. Hey, Vinesh, you've been on before, but why don't you go ahead and introduce yourself? Tell us a little bit, not just about what you're doing now, but a little bit about your past.
Sure, Jeff. Been with Rackspace now for a couple of months. About 7 months. My background in history is working for health plans. And helping them through the cost management as well as digital health journeys. So, been in the health plan space for about 20 years, and now looking forward to accelerating our journey into healthcare.
Awesome. Now, Sarah, we were chatting before we went live, and you made the comment, look, we've been doing this for 20, 30 years, however long it is. We've been looking for ways to help find innovation in and around this industry. And they're really, we're still using technology to figure out how to do that, but it's happening faster, and it's happening with so many more tools and capabilities that exist. Why don't you unpack that a little bit for the audience? What makes this, we'll call it this decade, so different from the previous ones that have existed before in healthcare?
What I would start with, Jeff, and I believe it's really important for people to have a perspective on, is that you say, oh, I've been doing this for 30 years. And that's not a space like, hey, I'm this dinosaur that's been doing the same thing for 30 years. It's more about, hey, I have 30 years of experience, started in a call center in a hotel when I was 19 kind of a thing. So yeah, I just gave my age away, which is also important because you think about now more than ever, we think about the macro impacts of what it means to run IT. So IT has historically been a cost center. And now that we are so tied to the revenue generation, there's still an impact on how dollars get spent, how companies invest. So everything from, especially being post-pandemic, it's really like I work in a company, we are 100% remote. We work where we are most productive. It doesn't change the conversation about how we spend for staffing, how we spend for governance around the right kinds of projects, how we think about the importance of renegotiating contracts and looking for consolidation opportunities, or as some of my friends will say, app rationalization, which typically would have been like a death knell. You're like, oh, I get to go do app rationalization for 1,000 assets in my organization. Except that when you start to change that dynamic, it really becomes about, if I am able to find the money over here or create this value opportunity over here, that means I get to invest in the things like the true customer or member experience. Some of my favorite, the cloud strategies and the ability to come up with solutions that move you to more of that virtual and true environment. How are we going to use the data and AI associated with that? Am I going to build it or am I going to buy it? And then all of that wrap around with cybersecurity components. Security used to not even, however many years ago, wasn't its own department. It was something that you knew about and you educated people very specifically around things like social engineering. Well, now you think about the wrapper that comes with all of that. All of it has to be funded somehow. So the role of the CIO or the CDIO now is as much about the ability to sit down with the business and work through their strategic planning and be able to partner with your CFO to bring it all to life in a way that is accretive to the bottom line. Because people say, well, if there's no mission, there's no money, there's no capability to do these things. You have to be super creative. You have to be a little bit unconventional while still being ethical in your ability to figure out how to get things done in an organization. I love the whole, and better, faster, cheaper has never changed. And so how do you do those things in partnerships that really bring everything forward together? My team and I spend most of our time strategically figuring out how to make something happen, because the truth about technology is it's already there. And so the answer is yes, you can. The question is, how can you do that within your own organization or the parameters that may exist for you? And then you start thinking about your partnerships and strategies to do that. Partners like Rackspace as an example. Really, the art of the possible is that it can be done. How do you want to figure it out for your own organization?
Yeah, so much to unpack that was in there. I love the conversation about how you're talking about how you and your team have to work with the business, and that is one of those areas that I think that this modern age of technology has made such a difference in. And IT used to sit. You've been around long enough to know IT used to sit kind of in a corner. We'd do our annual budgets. We'd make sure the system stayed running, but we were working on these time scales that were multi-year time scales. There was no big surprises that were popping up. We spent the year talking to the business, refining the systems that were there, as well as listening to needs that they had in their business that we might help to figure out what the next technology might be to solve for that. But it was I want to call it a slow pace, but at the time it felt pretty hurried. But now we're moving at a lot faster pace. So Vinesh, you with your cloud architecture capabilities and the things that you've been doing, you've sat very strategically from an architecture standpoint, even, with our current CTO and other roles, communicating those needs to the business up into there. So what is that balancing act like And is there anything unique to it in the healthcare industry of communicating the business need and providing technology solutions?
Yeah, absolutely, Jeff. I think it's critical to have business outcomes, right? I mean, we talk about value-based care as an example. The whole shift from, well, we'll, refer a patient and deal with him, to having more accurate information in terms of medical necessity, eligibility checking, encounters, the whole. And what we have realized is, technology is just an enabler, right, to doing these things. I mean, there's this whole argument about, will AI replace the physician? I don't think AI will replace the physician, but the physicians who use AI will replace those who don't, right? So it's always about the business outcomes, and it's always about, I think, what Sarah articulated so well is, you need to be able to deliver value for members, deliver value for physicians, but also the clinical use, right? And we've tried to solve these challenges. We were just talking about this. The problems have not changed. The technology has changed. So how do you not just leverage technology, but how do you get patients to use that technology, right? How do you use clinicians to use that technology, and then how do you improve the physician experience? I mean, the whole quadruple or quintuple aim these days. I don't know what it is, Sarah, but it keeps changing. It was the triple aim and then quadruple aim. So it's all about outcomes in the MA world. So.
Hey, real quick, folks, you guys are commenting so nicely, but unfortunately there's a tech snafu here and I can't see your comments. So let's see David in Michigan, sorry about the -2. And yeah, there's a nice looking pool behind those two folks over there. So you can look forward to that next summer. And so keep commenting. Your comments will get eventually through to me, through David, through Megan or Daniel. So, all right. So let's jump back into the conversation, though, because Vinesh, you said something interesting that I think we should jump into. And you said getting patients to use the technology, because that's one thing that's really different in a regular corporate context. And we think about how we go through digital transformation, or if it's working from a B2C, business to customer environment, we just need to make the app nice on the phone, or we need to make the website work well. But let's talk about some of the tech that enables the patient. Sarah, you guys at the Silver Sneakers, I would imagine, have some things that you lean on there.
We absolutely do. And what I love about, I think, today's continued generations is there's this fallacy once upon a time that seniors didn't use smart devices, weren't as active on their tablets or their desktops. And I'm like, my husband's 9 years away from being a senior, like literally like Medicare Advantage eligible. And it makes me laugh because he's what we call an age in. We expect him to use his smart devices. We expect him to access our content on the phone. He may still go to the physical gym network, which is part of the big, one of the biggest propositions that we have. But now it's that digital component of meeting members. And we call all of our seniors and our members versus patients, because our goal is to keep them out of the hospital, live longer, healthier, happier, independent lives. But we do that in conjunction with our insurance partners and with our different clients, because if you think about the ability to empower someone to utilize the technology effectively, it's about us being able to innovate in a way that meets them where they are. It's about being able to connect them anywhere that they may be. So if you go on vacation, or you go to even a friend's house, or you're visiting your family for whatever reason, you can still get to us, that content, that consistent connectedness. And then being able to share that information more broadly. We know what you're doing. Therefore, we can offer up to you the next best action for the things that you like to be able to do. What I love about that is we didn't really have a virtual footprint until COVID hit. We didn't necessarily need one as quickly as we did. And yet, just like everybody else, we pivoted immediately to get online and offer those programs. Now we're seeing such an uptick in the virtual component because seniors have a couple of things that go hand in hand. They worry about still getting some form of an illness. May not be as COVID specific, but it can be the flu, it can be RSV. It's that time of year where wintertime tends to be where you can get sick more frequently. More than that, seniors suffer from isolation and loneliness. And if they can't necessarily be in person at some of the activities they wanted to do, and you add that into the winter weather. So if you're -2 in Michigan with Megan right now, you're not going to get in your car and probably go to the gym, especially if you're 75 years old. However, you could get online with your favorite instructor, do your live class, and you may be in that live class with a bunch of your friends. So there's that aspect of community and connectedness that all comes together. And that's so important because I remember when the big push for like digital technology was getting people to use your patient portal because it was a meaningful use requirement. And we took it so much further, so much better than all those initial perspectives on it. And that's what's important for us is you create a space that makes it accessible to the user and they're going to use it. It's not about your age. It's about how easy is it to use your product. Anything that's easy to use, no matter what it is, no matter how old you are, you will continue to go back and want to enhance those experiences. So for us, that's a big piece of how we think about how we design and build and deliver content to our members.
Well, and it goes back to, I was listening to an audiobook today on a completely different subject, but the author made the point that is really humans go back to doing two core things. And that is they will do the things that either bring them pleasure or they'll do the things that help them avoid pain. And I think digital technologies really, in this scenario you just painted of the senior and it's -2, they're not getting in the car, but they can still get community and they can still get the benefits of being active that keeps them out. Now that brings up the big concern. The more things that are connected, be it our watches, be it our pedometers, be it our phones, be it our whatever it might be, our Oculuses, and put those things on and do the workout. New to that. That's great fun, by the way. Vinesh, it brings up a challenge that a lot of people are worried about, and that's privacy. And that's a good thing to be worried about because the more data that exists that is mine, that is somewhere else, I worry about those sorts of things. So what are some of those challenges that exist and how is technology helping to solve for some of those to give people the peace of mind so that they're not afraid to use the tool, so that they're afraid of maybe their data or security issues?
Yeah, I can take that a bit, and then Sarah can. I know she has a lot of experience in this as well. But as far as security, look, I think when compared to other industries, right? We talk about life and death here. So if it's a wrong diagnosis, for example, or a wrong CPT code is, placed somewhere in the record, it could cause a lot of issues for the patient, right? So extremely important, right? Privacy, PHI, HIPAA. I mean, that's all a part of this system, but also it's important to look at the patient as the consumer, right? And we talk about the challenges. For example, for us, I mean, it's okay to wait 30 minutes at the doctor's office, right? But if you wait like a minute in the Zoom, in a Zoom a synchronous call, you're suddenly now, it changes the experience, right? So it's a very different way of looking at the patient, not just from a security standpoint, but also from an experience standpoint.
Yeah. So Sarah, how are you guys dealing with the security aspects?
So what I love about the way that Tivity has information security structured is that our CISO, Paul Wolf, he reports to our chief legal officer. He's part of the whole compliance legal team. And then he and I are like absolute partners in everything that we do. So we automatically create this internal checks and balances for one another. And some of our conversations are drop down hilarious. Like you will literally be like, what? Like, I'm like, no, we got to do this. No, we got to do this. And our teams will be like sparring with one another to figure out the best way to do it. But it's that immediate internal check and balances. Like we have to get it right. And then how is that going to affect our member? How is that going to affect the senior? And we do think about things like online privacy for seniors is a different conversation than maybe what you're having with your kids. What's most interesting though, and something we've stayed very close to, is the fact that most of us, and I'm not, exempted from this equation per se, is that we're taking care of our parents and we're taking care of our kids. That's the age group that I live in at this point. And so to a degree, some of the things you do teach your kids, you are teaching your parents about the online safety and privacy aspects because it changes so rapidly. But more importantly, it's like, how are you creating that level of awareness that what do you respond to? How do you log in safely? How do you use this, in your daily life? And think about this. It applies to every other aspect of what we do. So it's not just in that moment that you're accessing online content or you're working through the different privacy aspects. With whom do I share this information? How can I make sure it's safe? The other piece is that's everywhere. And if there's a social responsibility for all of us to make sure that, again, it's accessible and easy to understand, but that we are educating the people that are responsible for taking care of these other individuals, because seniors get exploited more than any other group. And it's unfortunate that that's even a thing. And so we create the ability for programs to be simple to access. We don't ask for extra information that isn't necessary. We don't store the information and use it inappropriately. We don't sell data for monetization We use the insights to be able to create better programming for you. All of those things are pretty standard in the industry, Jeff and Vinesh, but unless you're really having it be an active conversation in your organization, it is something that could otherwise be missed. We literally, with every system, with every initiative, there's always the legal, the compliance, the security impact on our member conversation as part of that complete review before we put something into action. I'm hopeful all industries and all of my colleagues and peers are thinking about who is your end user and what do they need to feel safe in your environment.
So many great points to call out inside of there. I think one of those things to think about is you call it how the CISO is reporting into legal. And in the old days, a good day was a day I didn't have to talk to legal, and I didn't have to talk to because they come knocking on the door and you start to get worried about what's going on. And but now you need to be in that daily spar. I love the fact that you said spar, because spar doesn't mean a fight. Spar means a constructive engagement. And all towards the end that you're talking about. And that's how do we keep things safe? And so we, regardless of industry, but especially in one where we're talking about the security of individuals' data, that conversation almost has to be daily. It almost has to be twice a day, 5 times a day, engage. And that's why you see these new teams, when you dig down into the technical side, these DevOps teams that have security and legal as part of that core group, who are there to advise as the requirements are coming in to say, okay, let's spar about how the right way to pull that together might be. All right, let's shift the conversation for a second, because we are getting close to the end of our time. And that would be, what about technology has you most excited about the healthcare industry in 2023? And where do you hope we land when we're having the same conversation this time next year? So Sarah, we'll start with you.
Sure. There's probably 2 aspects that I spend the most time on. That number 1 is going to be the space of like the workforce engagement, because again, our team is 100% remote. You work where you are most productive. You heard me say that in the beginning. That means I'm fighting for talent all over the country. So yes, there's a space that says I used to be geographically centric and needing to recruit and hire talent. Now it's wide open, but so many companies have that option. Now, as more and more companies want people to go into the office and be more hybrid, I'm like, hey, I still have that advantage, because for me, that's like, hey, we're fully remote. But that workforce engagement, you don't get the drive-bys in the office. You don't get the, hey, let me run down the hall and have a conversation with you. It's very nuanced in the ability to have the 5-minute conversation, to have the quick check-in. It erodes a bit the space between work-life balance that we used to always say was important to have. And you're respectful of it. But like one of my VPs and I, he's on the East Coast, I'm in California. We chat late. Like last night, it's probably 7 o'clock for me, 10 p.m. for him. I know he's awake because I've been working with him for a few years. I'm like, hey, got 5. 5 always turns into 28 to 32 minutes kind of a thing. But that's when you find the time to be able to do it. That constant engagement, that constant perspective, because we're always solving problems. The engagement about always solutioning for what's there. And it truly is for us that member experience. How are we going to create the right strategies and the right solutions and the right product offerings and the right coming together of different opportunities for it to be compelling enough for somebody to want to use it? If they use it, everybody benefits. You're healthier, people make money, people are staying out of the hospital, all those different aspects. And you're giving your teams new and cool things to work on. Like, hey, we need to enhance this product over here. Hey, let's bring these, let's acquire this company and bring new capabilities to the marketplace that others aren't doing. So it's the constant adjacencies and the abilities to figure these pieces out. And for us, we're doing it all by putting in brand new infrastructure, brand new cloud strategies, brand new capabilities with partners that inclusive of AWS as an example. They've been with us on the whole journey, from the architecture and the design to the implementation to the capabilities that have come through towards the end. We've got about a 2-year journey to get completely into these different environments, but it's been really well thought out and really well planned. And as long as I can keep the team engaged for the mission of the work that we have to do with the right partners to make it happen successfully, it's a win across the board. And we're willing to always talk about what's going well, what's not going well, how do we course correct in the moment. That immediacy of sort of always on, it may not be for everybody. I'll be honest. Not everybody wants to work these 6 a.m. to 10 p.m. days, but it's not like you're working sitting in front of your computer all that time frame. You're just piecing it all throughout the day and throughout these different experiences, because our minds are always geared towards the constant ability to deliver something new and different and exciting across the board, both for our employees and for our members. So I feel like that to me is what I'm most excited about, because as we started. It's the rapidity of what we're able to do in real time that makes all the difference in the world today.
That's great. I love, you're calling out how we need to work this new method of work, and how, being kind of that always on may not be what's on for everybody, but it's also what keeps you from having to relocate maybe to the East Coast where corporate headquarters may or may not be. But it also takes, and I think this is part of how we see the pace of change moving so much quicker. And that is the fact that we don't have to wait from that window of 8 to 5 to be able to ideate something through. Great call out. Now, Vinesh, you already said something pretty fantastic earlier, and that was that you don't think that AI is going to replace doctors, but doctors who use AI will replace those who don't. So AI is obviously key for what you think in 2023, but what tech gets you excited in healthcare?
A lot of this is, it's not just AI. I look at it as IA, intelligent augmentation. So how do you leverage AI into the processes, right? And what's really getting me excited is obviously the shift from fee-for-service to value-based care. But as a result, the technologies and reimbursement policies are changing, right? So for example, the whole shift from hospital to homespital, right? So the wearables, the sockables, all of these, the breathables. I heard something recently where, you can check your breath before going for a date, but it also detects cancer, for example, right? So there's all this different, wearable devices, etc., that we can leverage to, drive value, because, as this is, I think this is the most entrepreneurial period, in healthcare, right? Because we are fundamentally changing how we pay for it in America, right? So we are moving from document and billing to who's not coming to the patient. So if we take care of them, perhaps we can, avoid a necessary trip to the hospital. So it's all around the leveraging technology, or technology is an enabler to move healthcare, which the problems, like we said, haven't changed, but the technology continues to change. Well, Moore's law, right? Twice as fast as at half the price. So that's going to really shift the gear, I think.
Fantastic. Well, folks, we are out of time, unfortunately. I wish I could have engaged more with the comments that were out there. I've heard there were a ton that got echoed through, but next time we'll make sure that they're showing up. But North Dakota -2 or -4. Why? I mean, you live in California where it's sunny. Obviously, the pool's still out. Anyway, Sarah and Vinesh, thank you so much for being on the program this morning. Sarah, thank you for getting up early with us here today. Absolutely going to continue the conversation. Vinesh is we are starting a series, probably happening about monthly, where we're going to dig into more and more of the tech around healthcare. So make sure that you're watching the agenda for those as they come out, and we'd love to continue more. So again, Sarah, thanks for being here. Vinesh, always a pleasure, and I will see you throughout the day, I am sure. All right, everyone, that is going to wrap it up for us again here today. Thank you so much for being a part of the program. You want to get a hold of us, you can do that by heading over to rackspace.com/solve. All of our content is there. You can also check out the podcast. If you missed this episode, we'll make sure the audio is available there as well. And with that, let's find the go-away music. There it is. And with that, we will be back next Tuesday. Folks, I've got a great show scheduled for you live from Turkey. Well, not me, but our guest will be. Sorry, my mixer's falling off. So I hope that you will be a part of that. We are regaining and restarting the use of our Tuesday, Women in Tech Tuesday. So we'll see you then.